Are you having a sudden flare of back pain or that sciatic type of pain that you're having difficulty getting under control? Hi, I'm Dr. Michael Cuthbertson, and I'm going to show you an exercise that will help you get out of pain. For this exercise, we're going to do a spinal decompression, putting a little bit of traction on the lumbar spine to help to open up those joints and tissues to take stress off of those nerves that could be bothering you. Go ahead and grab your exercise ball, and then while you're on your knees, go onto your abdomen and then slowly start to move forward until you feel a little tug on the low back here. There's going to be a tipping point right when you start to feel that as you load up on the ball, and you'll have to find that sweet spot. If you're back too far, you won't be able to feel it as much, and if you're too far forward, you won't be able to feel it as much. You're trying to get to the point where your gravity will pull on your legs to allow that traction and that decompression to start to happen on your low back. When you find that point, keep your hands on the floor. Your toes can even be on the floor as well. And then just ease into this, allow this to ease the tension in your low back. As always, to help to manage and regulate the nervous system and to increase further relaxation, you can use some breathing techniques, particularly breathing in and out slowly through your nose. That will also allow you to use the ball to decrease tension that has developed in the abdominal contents, which is a common thing that happens when you have low back pain. You're going to do this for anywhere from 1 minute to 2 minutes. And if we want to progress this, you can also get to a point where your feet are off the ground. You want to hang on to something in front of you to counterbalance you. And as your feet are off the ground and your knees and feet together and you're at that tipping, that sweet spot to traction the back, you can start to move your legs slowly side to side. That will further decrease the tension in those tissues in the low back. You can go to one side if you feel a little bit more tightness, or you can go to the other side, or you can go just simply back and forth. That's effective to get this to be an even more impactful exercise for the symptoms that you're having. Again, you might do that for another 30 seconds or a minute. So after you've completed this exercise, make sure that you come out of this position slowly. Especially if you've had a flare of symptoms, it's going to be pretty tender. Slowly come out of it. And you might want to sit here out of that decompressed position for a minute or two before you come up. That will allow your body to allow the nervous system to adapt to the traction that we've just put on it. And it will also help you as you come out of that position to stand up easier with less irritation. I hope that this has given you some relief. Let us know if it has. And for more content like this, don't forget to subscribe to my channel. And I'll see you next time.